Welcome back to the Mom and Mind podcast. I'm your host, perinatal psychologist Dr. Kat. On this episode today, I'm talking with Dr. Rebecca Dekker, a nurse with her PhD and who is the founder and CEO of Evidence Based Birth, as well as the author of Babies Are Not Pizzas, They're Born, Not Delivered. I really love this conversation with Rebecca. I fully believe that having information, being empowered to make decisions is protective of mental health. And from the hundreds of thousands of stories I've heard of people going through the perinatal period and struggling, one of the ways that I know for sure that people feel worse is when they feel disempowered, when they don't have information, when they find out after the fact that they had choices that they didn't know were available to them. One of the many reasons I love the work of Dr. Dekker and evidence based birth is that the goal really is to get information to everybody. EBB does this by boldly making research evidence on childbirth freely and publicly accessible. Dr. Dekker was an assistant professor of nursing at the University of Kentucky, and now with evidence based birth and her team at EBB, they are committed to creating a world in which all families have access to safe, respectful, evidence based, and empowering care during pregnancy, birth, and postpartum. You're going to hear a lot of great stuff in this episode today. It is chock full of things to think about, tips, tools, and things that you can readily use in your experience and become as prepared as possible for your birthing experience. So let's meet Dr. Rebecca Dekker. Welcome, Rebecca. Thank you so much for being with us.
Thank you so much for having me. I'm so excited to be here.
Yeah, I'm very happy to have you and your expertise on the podcast. There are so many stories that I hear all the time, people who don't have enough information about birth and what their options are and how to be empowered in that process. Your podcast is filled with information and resources and all of those things. So I'd love to start there. Actually, is how did you start the podcast and grow evidence-based birth in the beautiful ways you have?
Yeah, so I actually started evidence-based birth in 2012. Back before you would really start a podcast, you would start a blog.
Right, right.
And so what happened was with my first baby, I was a nurse. I was in a doctoral program and I was giving birth at the hospital where I was a student. And one of the things that was really important to me, aside from finding a nice OB, and I wanted a vaginal birth because I wanted kind of the least complications possible. The other thing that was important to me was just not making waves because as kind of a chronic people pleaser as a
Mm-hmm.
child and then a young adult, I had worked in the hospital system. So I knew what it was like if you had a patient that was a troublemaker. Everybody would talk about them. They often would get poor quality care just because they didn't make any friends, you know? And
Mm-hmm.
so for me, it was important that the staff like me.
Mm-hmm.
And I think sometimes when you're pregnant, you find yourself vulnerable and you don't want to make enemies, right?
Right.
So my goal was just to basically do as I was told.
Uh-huh.
And what ended up happening, I didn't realize, is if you go into birth not preparing and just willing to take whatever they throw at you,
Mm-hmm.
you end up getting poor quality care because that's what is typical in the United States.
Yikes.
And
Yeah.
coming from a different field of nursing, I did not realize that was the case in obstetrics.
Mm-hmm.
I didn't realize that so much of what they were doing was not evidence based, where I was giving birth. And so when they told me you're not allowed to eat or drink, you're not allowed to get out of bed, we're putting you on these monitors, you have to do this, you can't do that, you must have this.
Uh-huh.
I was, for the most part, just following their instructions, thinking they had my best interests in heart,
Right.
not realizing that a lot of what they were offering me was just because that's how they did things
Uh-huh.
on their unit.
Right.
So I ended up having a really long, well, it wasn't really long statistically. I think 24 hours is pretty average for a first time mom, but I did have a 24-hour birth, but I was not allowed to eat or drink that whole time.
Yeah.
Not allowed to use the bathroom, not allowed to move or walk around. I did get an epidural about halfway through, and I laid on my back for
Mm.
the entire 24 hours. So
Oh
when
my
time
gosh.
came to push, I actually put my call light on and said, I feel like I'm ready to push. I was so excited because,
Mm-hmm.
it's a long journey. It's your first baby.
Mm-hmm.
And when somebody answered over the intercom, they said, I'm so sorry. We're all in report right now. You're going to have to wait.
Oh my gosh.
And so
Oh, wow.
I
That's
know.
wild.
And, of course, I'm justifying everything. I'm like, oh, yes, it's 7 p.m. I should have known that. That's shift change, right?
Mm-hmm. Mm-hmm.
So what I just did is I kept pushing my epidural button to numb myself, to numb that pushing feeling.
Mm.
And by the time they came in 30 minutes later, I couldn't push at all because I was so numb.
Right.
And then after about an hour of trying to push and not being able to, um, I finally was able to push. It had worn off enough that I could push, but then I didn't make any progress because it turns out my baby was positioned in a posterior position where her back was against my back, which means
So
she
painful.
wasn't coming through the pelvis because of that. So my doctor did a procedure to help turn the baby. Nobody ever suggested I shift positions or do anything. Again, I was on my back the whole time, pushing in like the lithotomy position with my kind of feet up in the air.
Mm-hmm.
And then finally, in the third hour, I made progress. So my baby was born after 3 hours of pushing.
Mm-hmm.
And then they immediately whisked her away to suction her and clean her and weigh her. And I didn't get to hold her again for another 3 hours.
What?
So that was kind of, even though she was fine, her
Mm.
APGARs were fine. They took her to the nursery for observation, and I kept asking, "Where's my baby? Can I have my baby?" And they were just like, I think they were short-staffed. They didn't have
Oh my
the
gosh.
time or staff to bring her to me.
Mm-hmm.
And at one point they said, "Well, we can't bring her to you because her hair is wet. We just gave her a bath." And I said,
Whoa.
"Oh, yeah, she does have a lot of hair because she came out with this full, thick head of hair." I guess that would make sense. I was just justifying everything that was
Sure.
happening to me.
Right.
And then, as you probably have worked with a lot of parents, sometimes you don't really truly process what happened to you until a year later,
Right.
around the birthday
Right.
of the traumatic birth.
Yeah, that happens
And
a lot.
nothing felt traumatic, though, about this experience, right?
Mm-hmm.
I mean, I had a healthy baby. I had the vaginal birth that I wanted. Nothing bad happened to me,
Mm-hmm.
but something definitely felt off.
Right.
And I started questioning everything.
Sure.
Like I had just put my faith in the system. I believed in these healthcare workers, and I don't think they had bad intentions,
Right.
but that's when I made a list of everything that had happened to me,
Mm-hmm.
like a bullet point list of they didn't let me out of bed,
Mm-hmm.
they didn't let me eat, they didn't. They made me lay on my back. They did this. They did that. They gave me this rate of IV fluids. And then I went and I looked up the research on every single one of those things.
Nice.
And so what I found, because by this point I had graduated with my PhD, I could read the research, I could interpret it. And what
Mm-hmm.
I found is that most of the things that had happened to me were not shown by evidence to be helpful, and in some cases they're even shown to be harmful,
Wow.
particularly, keeping you on your back and not letting you out of bed for the whole
Right.
labor. And there were some things I will say that were evidence based. My OB, you know, supported me through 3 hours of pushing, which I
Mm-hmm.
think at that time was pretty unusual. And
Mm-hmm.
another doctor might have said, I'm, you know, let's just do the surgery.
Right.
My baby was small. She was only 6 pounds, 8 ounces. And my doctor said, I knew you didn't have a big baby. I believed in you. So I did think that having that provider who believed in me was a good thing.
Right.
But after that, I just decided I'm doing everything differently the next time. I really want to have a birth where I make decisions based on the evidence and based on what I want, not what I want to people please someone
Right.
for. And so I did end up having a completely different experience the next time. It was so different that
Mm-hmm.
after the birth, I had a midwife this time in the midwife model of care, and I asked my midwife, when do we give him a bath? This is shortly after the birth, and she goes, "Rebecca, honey, he's your baby. You can give him a bath whenever you want." And at that moment, it just really hit me.
Right.
Like, I'm a mom. This is my baby. Nobody can take him away, do what they want to him without my permission. Kind of like what happened last time.
Right.
I
Right.
never got to make those decisions about when my baby had her bath because they
Right.
just did it,
Right.
right? And then they said, "Well, you can't have her now because she had a bath." And it was such a simple shift, though. Like, from one of like disempowerment to
Mm-hmm.
empowerment
Mm-hmm.
that I really felt so empowered and strong. Like
Nice.
for the first time as a mom, like I could feel it in my fingertips. Like I can do this, and like I
Yeah.
am a mom. This is my baby, and I felt so powerful. And I was like, what if everybody entered parenthood that way? Not
Right.
just with, it doesn't matter the kind of birth that you have or where you give birth, but it's how you're treated and how you come out of it feeling like you made decisions and
Exactly.
you're powerful and you can do hard things.
Mm-hmm.
And when things happen the way you don't plan, you're able to shift and still make decisions. And starting off as a parent that way is so much, it's just so much better,
Right.
because then you're not dealing with all of these doubts and questioning your abilities. And
Mm-hmm.
so yeah, I decided from that point on that I wanted to help other people get that, have that feeling.
Right.
And so it was shortly after that that I was invited to come share about my experiences to some resident doctors, doctors who had finished their medical school and they were in their residency. And I shared my story and I brought them several handouts I made for them about the evidence on, it was like fetal monitoring during labor and eating during labor and movement during labor. And they said, can we have more of these? Like, do you have more of these handouts? Because we want evidence to base our practice on. And these were
That's great.
family doctors who were really working in an oppressive environment where the OBs were treating the family doctors like lesser than.
Oh no.
And even though
Wow.
family doctors have been around, you know, not as long as midwives, but longer than OBs
Right.
doing birth, right?
Right. Right.
So they loved it, and I decided to like, create a website and just start posting the research online. And I seriously thought maybe 10 people would find it, but it just took on a life of its own. Everybody started telling their friends and their
Nice.
doulas and their midwives and their yoga instructors, and it just kept
Yeah.
spreading.
Yeah.
So now it's, um, a website, a podcast, YouTube channel, and we have a childbirth class, and we have a team of about 12 total who, like, all we do is work on getting this research into the hands of families. Because, as you know, information is power, right?
Totally. Yep.
If you don't know what you don't know all the ways you can get sabotaged, right?
Totally. Yeah.
Yeah,
Right. Absolutely.
yeah.
Wow. One of my favorite things, well, that's a silly way to put it, but when people go through really, really difficult and challenging things and turn it into their passion is just the coolest because you know from like the inside what it's like, but then you've done so much work, and it's more than just your passion. It's supported by all this knowledge and research and it then goes on to empower other people. And I think it's just one of the more beautiful ways to come out of a really difficult
Mm-hmm.
experience,
Mm-hmm.
is to be able to on, pass on your knowledge and your understanding to other people.
Right.
Yeah, so it's great, right? You've done so much, and it sounds like even at the time when it was a blog post, when you were putting that out, there was such a need. People
Mm-hmm.
gravitated to that, and the need hasn't really died down, right?
No, no, there will always be, that's the thing too, is like we'll always be giving birth.
Right.
Maybe birth rates will go down, but families will always be having babies and facing questions,
Hmm.
and research changes too, you
Right.
know.
Right.
So new research may come out, we may realize that we thought something worked well. So I kind of like, I figure even though things are getting better, you don't see as much separation, for example, from your
Uh-huh.
baby in the
Uh-huh.
hospital.
Right.
That was 15 years ago. However, it still happens. Do you
Right.
know who it happens to?
I have a guess. I'll let you
Okay, it's
say.
it's moms who have C-sections.
Mm. Yep.
So
The reasoning
there,
is that their baby needs some support, or the mom can't hold them, or like what do you
yeah,
hear?
but it's a lot of it is just the inconvenience of managing the baby's temperature in a cold operating room. So there are ways you can do that.
Hmm.
And there's evidence showing that you can have that with kangaroo care, skin to skin care. You don't have to be separated from your baby right after surgery, but so many hospitals are set up to not support that.
Hmm.
So it's more about tradition, not about what's best for you.
Right.
And of course there are situations where you're critically ill or your baby is and you have to be separated, but the cesarean rate in our country is still, around 32%, 31%. And if 80% of hospitals are still traditionally separating, babies from their parent right after
Mm-hmm.
a C-section, that's still a significant number of people who are not getting that, who are getting starting off parenthood with their baby taken away,
Right.
which I
Yeah.
think
Yeah.
it creates, whether it's a macro trauma or micro trauma, that is not the easy way to start parenting.
Right. And not
Right.
what's best for either of them.
Right. And we can overcome it. Like, clearly, I still was able to go on and bond with my baby, but
Sure.
it made our first weeks really difficult because it made breastfeeding difficult.
Mm-hmm.
Um, I still worry about, what are the effects of, your first 3 hours in life just laying in an isolate alone with nobody holding you. Like, that
Right.
has to also create some birth trauma for the baby as well
Right.
that then they have to overcome.
Right.
Right.
Yep.
So I don't think, I mean, clearly humans are resilient and we can overcome challenges, but we shouldn't create those challenges
Right. Thousand
if they're not
percent.
necessary. Yeah.
Yeah. Yeah. Yeah. For sure. So what have you seen? You just mentioned a cesarean rate. Have you
Mhm.
seen that number go down? Are
I mean,
C-sections going
it's
down or?
plateaued, but so it's not going up, but it's not significantly going down. It's hovering right around that rate,
Hmm.
um, and probably will continue to stay around that.
Sure.
Hmm.
Yeah, my curiosity always lies in like sometimes people choose C-section and
Hmm.
that's what works for them and that's what's best and that's great. Um, but the amount of people who end up having a C-section who I don't know how else to say it, but like didn't really medically need it,
Hmm.
or at least if interventions had been done in a different way or not started in the way that they were, um, how many end up in C-section that like could have been a vaginal
I
birth.
think that I've seen that described, and I really like the term preventable cesarean.
Hmm.
I don't like the term unnecessary because by the time you have a C-section, most of the time there's a need for it,
Sure.
whether
Yep.
it was
Oh, that makes
preventable
sense.
or
Yep.
not,
Yep.
right?
Yeah.
But are there steps you can take to lower the chances of needing one? Absolutely.
Hmm.
Are there things you could have done in some cases, but not all, to help prevent it? Yes.
Right.
And
Um,
so that
yeah.
that's how I tend to frame it, in terms of like what first of all, what are your goals for
Hmm.
this birth,
Hmm.
um, and maybe the mode of birth is not important to you,
Hmm.
um, but maybe it is. For me, I knew I wanted to have more than one child. I do not do well with surgery and anesthesia, and so I was really hoping to avoid it because I do know it's a major surgery. That was my personal preference.
Hmm. Sure.
Um, and yet there were so many things that were done to me that just were increasing the risk that I would have a cesarean,
Hmm.
right? Which was not
Yeah.
in line with my wishes.
Sure. Yeah, thank you for that. That makes a ton of sense.
Mm-hmm.
Preventable versus unnecessary.
Mm-hmm.
That's really helpful. So what are some of those things that uh, prevent a C-section, or at least things that you like people to know about, going into birth for the first time? What are the things you really want people to know about their options, and how they can advocate or feel empowered?
Um, okay, so it's kind of two questions. So
Mm-hmm.
I'll do the preventing cesareans first. So there is research on this, and we cover this in the EBB childbirth class. Um, the evidence-based ways to lower your chances of needing a cesarean, first of all, is choosing a provider and a birth setting with a low cesarean rate.
Mm-hmm.
If you're giving birth at a hospital with a 45% cesarean rate, then your chances are almost one in two.
Mm-hmm.
I mean, maybe you could narrow it down to what's the first time mom C-section rate at that hospital. And most parents have no idea what the cesarean rate is at their hospital, but something you can easily check. Most of the time, it's published in the United States on a website called Leapfrog, where you can do
Mm-hmm.
hospital compare. It's a nonprofit, and hospitals voluntarily submit their statistics. And
Okay.
they submit their statistics for low risk first time birthing people. So it's you can kind of compare apples to apples from
Hmm.
hospital to
Great.
hospital.
I'll include that in the show
Yeah.
notes. Hmm.
Um, Knowing what your providers like what their practices are, what their cesarean rate is, because each provider is different.
Hmm.
Having support from a doula has been shown to lower your chances of needing a cesarean, and staying physically active and mobile during labor, so moving around as much as possible. Even if you have an epidural, that would mean like using a peanut ball and different positioning in bed. Requesting something called intermittent auscultation instead of the continuous fetal monitor. The
Hmm.
continuous fetal monitor by itself increases the risk of cesarean substantially, mainly because of the high rate of false positives on the readings.
Oh, wow.
And
Well,
there's
that's a
another kind
problem.
of monitoring of the baby where they just listen with a little handheld device
Hmm.
on a regular interval. That's
Hmm.
called intermittent auscultation, and that lowers the risk.
Okay. Great.
Staying well hydrated during labor. So if you're dehydrated, it
Mm.
increases the chance that labor will stall.
Mm.
Um, Waiting until you're at least 4 centimeters before going to the hospital, which it's sometimes hard to tell, like
Sure.
how far along you are,
Yeah.
which is again another benefit to hiring a doula is they can labor with you at home and give you suggestions as when it might be signs that it's time to go.
Hmm.
Um, and making sure you're given enough time to labor and push.
Hmm.
So patience is another um, aspect. So those are some. Another one is with labor inductions. So a lot of people are having labor inductions because doctors are saying that lowers your risk of cesarean, which really depends on the doctor and the hospital.
Okay,
Um,
interesting. So
yeah,
it's not like a mm, something that I hear just anecdotally is
yeah.
that having pitocin, let's say, increases the chances that a cesarean will happen. I don't know if
Well,
that's true or
not
not.
necessarily. It really depends. So, Pitocin can cause your uterus to contract too quickly, too close together, too strongly, which can then stress the baby out. But there are ways then you can pull back on the Pitocin. So, there's ways
Mm,
to manage that.
manage it.
So,
Yeah,
again, it just goes down to your healthcare provider and your hospital.
right.
Do they, at the slightest drop of a hat, go for a C-section, or do they say, let's slow the Pitocin down, let's
Hmm.
try
Hmm.
repositioning? Like these are some things we can do.
Great.
Um, yeah. So, but with a labor induction, if you're if you're going in for an induction, some people think I'm going to meet my baby today.
Hmm.
If you want to avoid a cesarean with an induction, you have to be prepared for that process to take up to 2 to 4 days days and nights.
Mm.
So, if you are expecting you'll have that baby today and 18 hours in you're tired and you want to meet your baby, then you'll have a cesarean.
Oh,
So,
interesting.
that's
Yeah.
something to keep in mind.
Right.
Sleep, managing your sleep and your rest and eating and drinking. And some hospitals still don't allow you to eat and drink during a labor induction. So, you can imagine going for 2 or 3 days without eating, then you get exhausted. So, knowing that it's safe to eat during a labor induction, and that's something we talk about in our childbirth class as well, um, is that eating is a human right.
Hmm.
People can't take that away from you.
Right.
Even if it's hospital policy to not eat because you have an epidural or not eat because you're being induced, there's no evidence that shows that that's necessary to withhold food. It
What's the
doesn't lower your
reasoning?
risk. It doesn't lower your risk of. So, what they're worried about with eating is they're worried about something called aspiration,
Hmm.
where if you need an emergency surgery and they put you to sleep under general anesthesia, that you might vomit your food and then it would go down the wrong pipe, so to speak.
Okay.
So that used to happen in the early 1900s, like
Oh,
1920s or
okay.
1930s,
Okay.
because
Mm,
they
it's a
did
long
not
time
have
ago.
safe ways of doing anesthesia.
Got it.
They would just give you random amounts of gas. You would conk out. You wouldn't have necessarily a trained anesthesiologist giving you
Right.
the
Right.
gas,
Right.
and they wouldn't put a tube down your throat to protect your airway.
Okay.
So now, clearly today, we have very strict rules and procedures for when someone's put under general anesthesia.
Mm-hmm. Mm. It's
And
just one of those
aspiration is
like
incredibly
holdovers.
rare. Yeah.
Okay.
So these are all just, there's a lot of things to think about. And this is all
Sure.
the kind of stuff that people don't know what they don't know,
Right.
right?
Right. Right, right, exactly.
Yeah.
And one of the reasons, um, one of the many reasons why it was important for me to have you on is because all of this is so overwhelming to people. To
Hmm.
they, like you said, they don't know what they don't know, and they don't know where to start. And anytime you're going into a process like even pregnancy or birth, postpartum, and you don't have information, the likelihood of that impacting your well being, your mental state, your mental health is huge. It's because like not knowing, not feeling empowered, um, in some ways can, if you're in a birthing environment and you're being rapid fire asked questions or being given multiple options and you don't know what to do, it can be really anxiety provoking. And for some people who end up experiencing, have traumatic experiences during birth, that has a massive impact on them, and their first days, weeks, months, sometimes even years of postpartum. So being empowered is one of the ways to prevent, in some cases, how much that birthing experience can impact you negatively if it ends
Right.
up being that.
I mean, if you think about it, and I know you're an expert in perinatal mental health, but giving birth alone puts you at risk for mental health issues
Yeah,
because of all the hormonal shifts and
totally.
then the lack of sleep and the huge, massive change in your social situation.
Right.
So we
Right.
don't want to add a traumatic birth experience on top of that,
Mm-hmm.
right?
No, not at all.
Yeah.
No, it just impacts so many things. I mean, you were saying a little bit about, how that can impact connection,
Hmm.
and for sure, I see that, in a lot of, even if I'm not talking necessarily about C sections at this point,
Hmm.
just any way in
Traumatic
which
birth, any
somebody,
birth can be traumatic,
yeah,
right? It can look to the staff like a normal, healthy birth,
right,
and yet the person could have been traumatized.
right, right,
Maybe by something that was said, or maybe by the pain of the experience, or
mm-hmm.
maybe by not feeling supported, or maybe having their wishes ignored or dismissed. There's so
Right,
many different ways they can feel disempowered by a birth.
absolutely.
And so I think when you talked about ways of like preparing, I think for me the number one is doing whatever you can to make sure you have a truly supportive healthcare provider and birth setting.
Mm-hmm.
Because if you have a trusting relationship with a provider, then even if you experience unpredictable medical complications, you'll
Mm-hmm.
still feel like you have someone who has your back,
That's
right?
right. Yep. Yeah,
And who
I've
can
heard
give you,
that in so
yeah.
many people's, stories, who are coming in for therapy, that
Hmm.
how much of a difference it made to know that there was a supportive person on their team.
Right. Who listened to them,
Yep.
who gave them information, who didn't
Mm-hmm.
pressure them,
Mm-hmm.
who said, I'm here for you, and
Right.
made you feel that caring.
Right.
And even in the midst of really terrible things that can happen in
Mm-hmm.
pregnancy and birth, hopefully rare, but they can happen.
Mm-hmm.
It makes all the difference. So knowing you have someone you can trust. And one of the problems with the way our maternity care system is set up is that most providers practice something like called call rotation.
Mm-hmm.
So you don't know who's going to be at your birth,
Oh,
right?
right.
So that's the opposite of what we would call continuity of care.
Okay.
Continuity of care is when the person who is there when your baby is born is someone who is known to you. Like they're not a stranger. You've met them before. You
Mm-hmm.
have at least somewhat of a relationship with them.
Right.
And so that's another question I recommend when you're hopefully early in the process is find out what is the model of care at that practice.
Right.
How many providers are they? What kind of schedule do they work? What are the chances you'll see different providers? And it's almost like, that what do they talk about when one person is the weakest link in a group setting or group project?
Yeah, I know what you're
You're
talking
on,
about. I
you're
can't.
only as strong as your
Mm-hmm.
weakest link. So
Mm-hmm.
if there is a provider in that practice who is disrespectful or dismissive, then what if you get that person?
Right.
So you're not just interviewing the provider, you want to know, like, what are their colleagues like?
Mm-hmm.
And I think one of the best ways to find that out is to ask the local doulas. And so, in the process of interviewing doulas, if your doulas that you interview show body language or outright say, I prefer not to work with that provider, that's because they've seen something before.
Oh, sure.
And so, use the doulas in your community as like they are the experts. They see the practice patterns of every doctor and midwife.
That is really good
Yeah,
advice.
so they're like, your inside scoop, basically.
Right?
And um, yeah, I've had many people, I feel like, prevent birth trauma by switching providers. So we have this evidence-based birth childbirth class, and once a month we bring a different graduate on to share their stories. And it seems like half the stories are, I switched providers to somebody I felt I could trust.
Wow.
And then it makes all the difference. But a lot of parents are afraid to do that, or they can't do that
Right.
for practical, financial reasons, logistics. And so, what I focus on then is giving you all the tools so that you can feel totally educated, totally supported by your partner or your family or your doula,
Mm-hmm.
and that you have the communication skills to be able to speak up.
Right.
And not only that, but your partner, whoever you've chosen to be with you, also is confident in speaking up. So
Right.
I'm a strong believer in rehearsing different scenarios, and we do that in our childbirth class. So
That's great.
we'll say, well, first of all, we'll practice building a good connection with your care team, like how to introduce yourself to your nurse,
Right.
how to ask questions at a prenatal appointment, and we actually practice that because what I used to be a college nursing professor, and I taught other classes as well. And one of the things that I found really interesting about that age group of like 18 to 22-year-olds is, they're learning about birth because it's a college class they have to take.
Mm-hmm.
But most of them have never been in a hospital setting as a patient. And
Mm-hmm.
that's when I started realizing that when families go in to have a baby, often it's their very first time being admitted as a patient in a
Right.
hospital,
Right.
and they don't understand how the system works. They don't know what it means, what the different staff roles are. So we start from the beginning and we teach them like how hospitals are organized, and here's how you introduce yourself to your nurse and get to know them and understand that 1 in 3 labor and delivery nurses has current symptoms of PTSD. And so understanding that gives you more compassion for the healthcare team and allows you to like approach it with a spirit of collaboration
Yeah.
and teamwork. And we
Right.
so we practice things like how to um, how to ask questions of your nurse, how to ask questions of your doctor,
Mm-hmm.
how to speak up if something is happening that you don't want.
Can I that is all so useful,
Hmm.
and also if I can just have you kind of repeat what you said. You said 1 in 3 have symptoms of PTSD.
Yes, from a
Oh,
previous birth that they've
right.
attended.
Right.
So
Yeah.
we have rates for midwives and nurses. I think the rates of PTSD for midwives is around 40%, and I don't have accurate numbers on doctors because it's not studied as well. But I would
Mm,
assume it's really high.
right.
And then also got to bring in the whole fear of litigation. Obstetrics is the highest risk profession for being sued. And so a lot of what happens in hospitals is based on those fears
Mm-hmm.
rather than what's best for you right now in this moment. It's more about, um, they call it CYA medicine, cover your ass. Yeah.
Right. Right.
So you have to take that into account too. I'm not saying that people suggest things only protect themselves from lawsuits, but I'm saying it's a factor in
Right.
how they practice.
Right. I think that is such an important point because right, you're going into whoever's birthing is going into a system,
Mm-hmm.
um, and it's important to know that some of the decisions they might be making are coming from this perspective because I think it is also could potentially be empowering to the person who's birthing, um, to feel like they can speak up for themselves. Not like they're
Right.
going in there to fight against this system, but there are sort of forces at work
Right.
um, that may be impacting how the providers are making decisions and whatnot. So yeah, it's okay to speak up and say something and let your wishes be known.
And this is just the beginning of using your voice for your child, you
Hmm.
know? It's like you're speaking up for yourself, but also for your child. And I have had to use these same advocacy skills, which is basically just being able to use your voice
Hmm.
so many times with the dentist, with, with your kid at the dentist, with
Right,
the your kid at school, with, different things that happen with your child. Like if you don't speak up for your child, who will?
right.
And eventually they can model that behavior from you and they learn how to speak up for themselves as well.
Hmm.
And as they get older, you can be like, all right, now I want you to practice talking to the doctor,
Hmm.
you know?
It does.
So,
I love that that's part of your process in supporting parents because it is so different learning something and thinking about it than
hmm
like than being able to express it and say it, especially
hmm
if it's not something you're used to doing. It can feel really like awkward and words can kind of fumble out. Um, and that the point you're making about practicing uh, using empowering statements or asking for what you need in and of itself, I imagine could be part of a
hmm
healing process before you even get into that
right.
scenario.
And you still might freeze up,
Sure. Right.
and that's totally understandable. I think this is where having a partner who knows your wishes and has been
Hmm.
through like the education process with you, they
Hmm.
can help. A doula can help slow things down. So
Hmm.
if because you mentioned earlier like feeling overwhelmed and getting in that anxiety induced state. Well,
Hmm.
what if you're in labor and you feel like you're being pressured into something but you don't? One of the things you can ask is this an emergency? Like right
Hmm.
this moment.
Right.
And if it's not, think of ways to slow it down. So a lot of doulas will, say maybe it's a good time to go labor in the bathroom for a while. Like go to the bathroom, just you and your partner, breathe, get some privacy.
Hmm.
There's ways you can slow down the process, lower the temperature in the room so that you can gather yourself again.
I would love to hear more of those tips if you have
hmm
them. I think that those are great.
Okay. I think
Like if you're
if you're
feeling pressured,
if you're
yeah.
feeling pressure,
Hmm.
um, I'm trying to think what I do when I'm feeling pressure is just, again, ask yourself, is this urgent? Like, is this a life or death right
Hmm.
now in this
Hmm.
moment? And that can happen in birth, but it's very rare. So
Hmm.
most of the time you do have time,
Hmm.
right? And then another tip that we teach is to ask, and this is a very common doula and childbirth educator trick, is the acronym BRAND or
Hmm.
BRAIN. Have you heard of that before?
No. Mm-mm.
This is helpful in any healthcare situation. So you ask these questions. What are the benefits?
Mm.
What are the risks? What are the alternatives? What if we do nothing? So that's the N. And then D can stand for like discuss and let me discuss it with my partner and we'll get back to you with our decision. So it's a really nice formula way of gathering info and and then giving yourself space and time. And
Mhm.
that's actually part of informed consent, which is your right as a patient is to inform
Mhm.
consent and refusal.
Mm.
And so it's a human right when it comes to your body that you have to be able to give consent. And
Mhm.
true consent means you've been given all the info on benefits, risks, and alternatives.
Mhm.
One of the alternatives that sometimes people forget about is, well, what if we just do nothing? What if we just wait a little bit,
Right.
right? And
Right.
then maybe come back in an hour or two. And then giving yourself space to discuss and decide. Another thing you could use if you really just need some privacy is say whether or not you're a religious person, you could just say, I would like some time to pray on this.
Mm. Nice.
And there's like no faster way to clear a room in the hospital if you
Ooh,
say you
that's a
want to
good tip.
pray.
Hot tip.
Yeah. Hot tip.
Right. That's great. Um, That's great. I mean, right. I love that. Even if you're not religious, like or you're
Well,
not
I mean,
using
most
prayer at
people are
that
at least
time.
spiritual, right? And so if you
Sure.
want some time to meditate on it, or
Yeah.
but using the word pray,
Right.
hospital staff are like legally required to respect people's religions. You know, it's part of their policies,
Mhm.
and so I don't want to call it playing the religion card because I don't think it's done in a manipulative way. Like if you really do feel like you're in
Right.
distress and you need time,
Right.
then you can absolutely ask for time to pray on on whatever you have to decide.
For sure.
and and
That's
then you can have an honest discussion with just your partner or whoever else you want to include in that
mhm.
discussion
Mhm.
about what you plan to do.
That is so important. Just asking for space
Right,
um
and time.
and
Mhm.
time. Yeah, I mean the hospital rooms are busy. There people
Mhm.
are in and out all the time. I mean they're doing nurses and whoever else are coming in and out to do their job. Um so it's not, I mean, how much time do you really have alone in that room on at any given time or with any regularity?
Yeah, and I think there are ways to change the environment in the room, and that's another way you can lower your anxiety.
Hmm.
Is is whether it's your doula or your partner, one of them should have the job to create a calm, soothing environment. So a lot of doulas will bring twinkly lights with them to the birth, but you
Okay.
can do that as well.
Hmm.
Battery operated candles, that sort of thing. Dim the lights, put up twinkly lights, and put some calming music on, and all of a
Hmm.
sudden it looks like more like a spa than a hospital
Hmm.
room, right?
Right.
And then it changes the attitude of people who walk in the room
Ooh,
because then they
right.
walk in more respectful, more calm because they're
Hmm.
reading the energy in the room, right?
Right. Right. I think there's something too to be said. I've thought about this every time I've gone into like a hospital or let's say like to watch a court proceeding or something. Um, we are going into people's place of work and it's
Hmm.
something they're used to and they could
Right.
just be doing things by rote and it's just or whatever they're in some kind of flow but like that what you're saying makes so much sense like that little change to the environment
Hmm.
um, can change things up for them. And I don't know, maybe even not that you have to do it this way, but now that you've said it, like maybe even be supportive to them
Yeah,
if they're in a
exactly.
calm environment.
Right. Right. Then they're going to love coming in your room and they'll
Hmm.
feel at peace in there.
Hmm.
It just has a different energy level.
Yeah.
And you know, the way hospital birthing rooms in the United States are set up are just they're made to kind of create stress. You can do a whole anthropological study on the hospital room and the bed, like this throne in the middle and all the
Hmm.
equipment, and it really from the time you walk in it makes it feel like it's an emergency and
Mm.
this medical procedure when really what you're doing is like what humans have done as far back as time. You know, it's something like
Right.
also ancient and new,
Right.
and doing something little to take that space back and to make it that kind of sacred moment of a
Hmm.
new life entering the world is really a cool way to lower your anxiety.
Definitely. Oh, yeah, that right. Again, makes so much sense. And when you were saying that about, since the beginning of time, um, beds weren't a thing, and people moved about in whatever way felt mm, good to them or natural to them.
Hmm.
And you were talking a bit before about, having to stay in the hospital bed for so long. So,
Hmm.
like, some people think they have to stay in the bed and don't know that they can move in different positions. What are some of the other things you've seen that are helpful, beneficial in terms of birthing positions and how that can help people?
Yeah, upright birthing positions are really important. So I have a full research article on that called "The Evidence on Birthing Positions," and you can find it at ebbirth.com/birthing positions. They not only help you physiologically, like with the birth, it goes faster and easier, but it's less painful when you're upright. We're
Mm-hmm.
not exactly sure why, but the pain levels are lower and anxiety levels are lower, and you just feel more empowered is what
Mm-hmm.
women have said in research studies. So some ways you can use upright positions is first of all try to avoid being tethered to things if possible.
Mm-hmm.
That's why I talked about the kind of monitoring, instead of being hooked up to the continuous monitor, have the intermittent monitoring.
Mm-hmm.
Um, if you can have your IV capped up and instead drink fluids by mouth, sometimes that's an option. That's not an option if you're really nauseous or vomiting, but for some people, drinking fluids instead of having the IV hooked up to them. And then having props in the room to help you stay upright. So having a birthing ball. Most hospitals have birth balls, but you can definitely bring your own, or your doula can bring one. You can use dancing. There's a lot of fun TikTok and Instagram videos of
Mm-hmm.
people and YouTube videos of people dancing in labor. Is also lowers pain and helps the labor progress faster. Being in a tub of water or a shower. So those are also ways you can use gravity to be upright and help the baby come down. But if you're in a tub, then you also get the benefits of feeling weightless, like buoyant,
Mm-hmm.
and it's very soothing.
Mm-hmm.
And that also has been shown to have a lot of benefits, getting in a tub of water. So there's actually really pleasurable ways you can move around. Like most people, if you watch videos of people dancing in labor, like in between contractions, they're smiling and laughing, and it's raising their endorphins and their oxytocin
Mm-hmm.
and lowering anxiety.
Mm-hmm.
So all of those things, I think being in a tub, for me, that's how I managed pain with my second and third births, because I did not have an epidural. And I combined that with self hypnosis using something like hypnobabies or
Nice. Yeah.
hypnobirthing.
Mm-hmm.
And you combine that with being in a tub, of being like immersed in a tub of warm water. And it's really powerful. Now, it's not going to work for everybody, but for some people, that's all they need. And then that again gets you calm and gets you
Right.
centered.
Right. Yeah. I mean, all you're talking about, the fact that people have options.
Mhm.
Um, the more times I've heard where people have felt stuck, they didn't have options. They felt trapped even sometimes. The
Mhm.
higher anxiety they end up having, or the more trauma that they have had to deal with because of that experience. So just even
Right.
knowing that you have these options, you have this toolkit essentially that you can draw from going into it. Right, you don't know exactly how it's going to play out,
Right.
but being able to listen to your own needs, listen to what your mind and body are telling you, and to be empowered to ask for that or state that that's what you need really goes a long way for mental health.
Yeah, and if you want to use a tub in a hospital, find out if your hospital has tubs. And then another thing I teach people is to actually make that your partner's role, that when you walk in, ask for the room with the tub if
Really.
it's available. And
Mm-hmm.
it's not always going to be available, but you can ask. And if they don't have one, then ask to get in the shower you know, when you need it. So
Right, for sure.
most rooms will have a shower.
You've given so much amazing information, and already I know that people who are listening know that they have options and how relieving that can be. What are if people who are walking away from our conversation today, what are the top things you would want them to know?
Yeah, I think there's so much information about birth, it can be overwhelming. So that's one reason I recommend people get educated. Use this pregnancy to, or if you're not pregnant yet, but you're planning on getting pregnant, just start educating yourself. Um, I think taking a comprehensive childbirth class can be really helpful, even if you've given birth before, but you want a different experience this
Mm,
time.
mm,
So take a class that will teach different comfort measures, hopefully focus on advocacy using your voice. Um, you can also, if anxiety is an issue for you, I think the self hypnosis programs are really great for lowering anxiety. And then I think listening to empowering birth stories. I know you've had to listen to a lot of traumatic birth stories.
mm-hmm.
And for me, that was something that was really helpful the second time, was to focus on filling myself up with um, like more inspirational and motivational stories rather than listening to all of the trauma.
Right.
Um, and I also did not allow people to tell me their traumatic birth stories while I was pregnant.
Nice.
Like when I'm not pregnant,
Yeah, let's put that one up in lights.
I think it's important for us to listen to each other's stories,
Yeah.
but if you're pregnant, you have to really protect your mental health.
Hmm.
And just constantly absorbing other people's negative stories is not good for
Right.
you.
And unfortunately, that seems to be, for
Oh,
whatever
yeah, you go to
reason,
a
the
baby
thing that you
shower,
hear. Yeah.
everybody starts telling their horror stories,
Right.
right?
Yep.
It's just like tradition. It's how we, you know, we get it off our chest, but we shouldn't be putting that on someone who's pregnant.
Hmm.
Right.
Yeah.
Unless they want to hear those, which
Right.
which is a possibility. And then, if you're able to look into hiring a doula, if finances are a barrier, look into programs where there are grants or nonprofits that pay the doula for you, and just see that as, just further insurance that you've got someone in your corner in the room. And also make sure you have a trusting relationship with your provider. If you have had a bad experience with them before, don't stay with them. I have met countless women who are just planning to birth with the same doctor who they felt traumatized by the first time.
Mm.
And so I think switching to somebody that you can have a more trusting relationship with is important. And doing your research and study who this person is and where you're giving birth, and make sure it's the right choice for you. And if it's not, but you have no other choice, then really like shore up your other support system.
Right.
So that's kind of like what I tell people when they ask, like, what are your top tips?
Right. And those are very
Mm-hmm.
important. And people can go to your podcast, Evidence Based Birth, and learn about a lot of other evidence based things. And I thank you so much for taking the time to come on and talk about this and being a resource and being an advocate in a lot of ways, just out there letting people know that they can have a different experience. Thank you so much.
Thank you, Dr. Kat. It's true, you can have a different experience. It doesn't have to be bad.
Thank you. All right, so now you know. If you didn't know before, go to evidencebasedbirth.com. You can also find them on Instagram at EBBBirth or Facebook Evidence Based Birth, and connect with the podcast Evidence Based Birth. Honestly, there are well over 300 episodes and counting, and so much information, as well as resources to help you make the decisions that help you feel empowered in your birthing process. And be sure to follow along the Mom and Mind podcast wherever you listen to podcasts, as well as on our social media. If you're following along, each of these episodes are delivered directly to you and will continue to provide the personal stories and the information you need to have the best perinatal mental health experience possible. Thank you so much for being here. Until next time.